your physical health, it's really important to manage those things too. If you are not managing your diabetes and you get an infection, you end up in the hospital, or you end up not at the hospital because you can't afford the hospital. So it's just to keep people working, to give them a sense of stability, and to just kind of make sure they're taking care of their entire body.
I think I think that's really an important point. We my team and I, we came to Metro, and we were certified as recovery coaches, and so when we work with individuals, we're looking over all the domains of wellness, and one of our primary interests initially is, you know, when is the last time you've seen a doctor? When have you taken care of yourself? Especially if someone was previously incarcerated, they might not have shared their health needs for fear of being moved about in the jail. And so oftentimes that's just going hand in hand with our coaching, with all of our wellness domains.
And I think too, a lot of times we get stuck in a mindset, especially with any type of substance use disorder. You are trying to go from point A to point B and point C with as little interference as possible. But sometimes we get so caught up on point A that we can't even see what might come next. And we become reactive instead of proactive. Mm-hmm. So our health and our health care almost becomes secondary, tertiary, mm-hmm. you know, that kind of thing. And we're not really thinking about those things. But there are some really great resources. And I think people think that that's just something that has to come later. I really can't think about that right now. But our health is so very important. And especially like you were mentioning too, like, especially for someone who is in recovery. So, and there are some great resources, healthcare navigators, people who help with insurance, people like Interfaith who help people who are working. So I think there's a lot of resources out there to kind of help navigate that system too, which can be overwhelming.
And our organization also provides dental care. So that's more than extractions. It's crowns, partials, dentures. And so we're able to do a lot of restorative work for our patients. And that makes the difference in whether they can work. You know, a lot of our patients, they have public facing jobs, customer service jobs, and it's hard for them to work if they don't have a full mouth of teeth. So I think just for their mental well-being too, being able to do that for people is a big deal.
It's a huge impact on self-esteem, confidence.
Yeah.
Wonderful. Thank you. All right. And then in terms of our other areas we want to talk about, you know, beyond or in addition to medical care, recovery, it also requires a network of people, just like we were talking about, right? Different programs that support, encourage, give accountability, and all of that wonderful stuff. So given that, let's talk a bit more about recovery-focused groups and programs. So it could be Anne, it could be Allison, whoever wants to speak to it. What role do recovery coaches support groups? We have a little bit of an audio issue. I think we're good. Okay, so what role do recovery coaches, support groups, and ongoing therapy play in sustaining recovery?
Well, recovery is connection. Addiction is a disease of isolation. And so one of the things we try to teach and help people understand early on is that we need people. And we need like-minded people. We need folks who are recovering and are moving towards that positive direction in their lives. And so support groups become paramount to success as a recovering person. Recovery coaching is a beautiful peer one-on-one case management type relationship that can be super helpful and important to folks trying to navigate life without the use of substances. So, but both of those things are really go hand in hand and can help someone. Well, it can make a difference between being able to stay clean and not. And when we talk about support groups, I mean, there's all kinds of different support groups. There's no one way or one right way to be a person in recovery. We have 12-step groups, or we have Dharma recovery or smart recovery. There's celebrate recovery. There's all kinds of different support groups, you know, to put people together who think alike or who want to be a part of that particular support group. I mean, and there's also support groups for other addictions. I mean, we have a support group for folks who have trouble with food. We have support groups for people who have problems with sex. We have support groups for people who have issues with gambling, you know, relationships, those kinds of things. So, you know, recovery is not just about addiction. I mean, about drugs and alcohol. It's about, you know, it's a lifestyle. So there's lots of ways for folks to get connected with one another that's really helpful and allows someone to not feel alone and learn how to live this life.
I love the first thing you said, recovery is connection. That is a beautiful thing. And I think it's true. And so part of the Knoxville Day Reporting Center, I work for the Community Resource Center program, and then we have the Day Reporting Center program, which is an intensive outpatient program. Through that, our participants are usually court ordered, and they go through a number of different programs and classes and courses, and it's almost as though you can see when someone begins to distance themselves, when people start to break down those relationships that they have formed. You know, something is usually going on. Like you can almost foresee a little bit of a downfall coming, which is really sad because there is so much to be gained from a supportive network. In the Community Resource Center, we are just 2 people covering 16 counties, and we don't have any money. That's one big question that we get asked. We have no money. We are a state-run program, but we can be listening ears. We can be helping hands. We can help people find resources. And even when we have absolutely nothing to offer, we can hear you and we can see you and we can validate what you're feeling. So even when I feel like there's so much value in reaching out, even if someone has, I feel like in my own life, even if someone has nothing to offer me, they really do. They really have something for me. They've got something to teach me. They can help me to grow. You know, I feel like there's value in every single person I interact with. And I hope that, you know, we can spread that word among our neighbors who might be struggling with substance use, that there are people out there who want to support you and want to see you grow and want to encourage you and love on you. And they come in all different shapes and sizes and all different places. And even though we are under that Department of Correction umbrella, there are people there too that want to see you succeed. So, yeah.
And I think it's a great model that you were talking about and making these connections and relationships, because I think as a recovery community, we do the very same thing, in partnership with one another, forming those relationships, sharing resources, sharing support. It's really difficult work sometimes. It's very painful sometimes. It's exhausting. It's the most rewarding job I've ever had in my life. But I couldn't do it without the community of other providers. And we're very lucky in Knoxville to have such incredible resources and choices for our clients to help them find that path, that recovery path that's going to work for them.
Wonderful. Thank you, everyone. So let's say that I'm someone who does not have a case manager, who is not connected to anyone in the work, who maybe I either don't have insurance or I don't have the right insurance, which might make it seem like I just don't have insurance at all. And I have all these questions and I don't know what is right for me. If I'm in this kind of situation, what is really the best or the way that you would recommend helping that person identify or access these resources that we're talking about? Like, how do they find you? Or if you're not the best fit given their goals, how do they find other people who would be?
Me. I mean, that's what we are at the Gateway. I mean, we're a recovery community center. So we're gonna, though every one of those questions could be answered here, you know, to help someone, guide someone in finding their path to recovery and do it in a safe way with folks that's their only goal. We don't get paid. I mean, all our services are free. And so there's no question that we would, you know, that it's about that, because it's really about connecting folks with their path, whatever that looks like.
And like Susan said, we do have a beautiful community that's so full of resources, and we're all intertwined and we're interconnected, and nobody's competing with each other. It's all what is best for the client. And so if we can get them to the gateway, we can get them to Ms. Ann, maybe we can get them a specialized case manager that is going to meet them exactly where they are, and, you know, they'll kind of go from there. But finding a hub of resources is a wonderful place to start, I feel like.
I like to think that maybe there's no wrong door, that someone could reach out to any of us in this room, and we would help connect them to whatever they needed.
Wonderful, thank you. So then, given all of this information, all of these wonderful resources our community does get to boast, because there are some areas, especially our rural neighbors, who they really don't even have half of what we have in this county. But given that, and how recovery is connection, as like Ann said earlier, you know, it's more than just medical and just one side of the puzzle. It's all of these things. It's having community spaces. It's being able to realize, oh, I can work on my wellness too. Let's talk about what is available here. So, Erin, I have a more specific question for you, because Parks and Rec, you know, people might think of the show and then that's pretty much it. And they might not understand all the great things that we have right here at our doorstep. So could you talk a bit about generally what can Parks and Rec do in helping build community spaces, like where people can gather, they can enjoy the outdoors, or they can just at least connect with other people?
Yeah, so one thing that a lot of times when people think of Parks and Rec, they think, like, if you grew up playing tennis, it's like, oh, you work for Parks and Rec, do you have tennis courts, or do you have baseball fields? And so a lot of people just have a couple little things that they're interested in. And so we have an infographic where it's parks and courts and skate parks and dog parks and golf courses, and like the list is ridiculously long, which is really good. And so I think in that it connects here that, you know, so we've got, you know, from a park where anybody can just go and, you know, walk, like we've heard from I think it was, I can't remember what it's called, Opportunity Youth, who a female said, I just go to the park to get away. I just want to go and relax. And, you know, that's it's, you know, it's free, it's simple, it's individual. I met a guy a couple months ago who, he said he's a recovering addict. And he said, if I don't I like to go run, but I have to do at least 8 miles to get what I need. And I'm like, I've never done that. So I was like, I'll take your word for it. And, you know, so that's kind of the outdoor, just kind of open, you know, kind of pick your flavor, pick your passion kind of thing. We also have community centers, art center, places where there are programs that are offered to where people can get involved, whether it's with others who are in recovery or just, you know, intermingle with, you know, many other people. One example we had over at Castle Park on Winona, probably 8 or 10 years ago, there was a group who the person in charge of the group came and signed this group up, and he was like, we're not going to be any good for an adult softball league. We're not going to be any good. I just think it'd be good for the guys to get out, you know, play and, like, you know, do something and, you know, playing other teams. And so they were bad, really, really bad. But it was a recovery group, and I think it was from the drug court. And like most teams have like dry fit shirts with a logo and a number. They had white t-shirts with Sharpie numbers on it. And so the team I played on, it was probably the third or fourth week we were playing that team, and, you know, they're trying to figure out not like who can, you know, who's the best in this spot. It's like, who can play the infield, who can play the outfield. And like, they got beat real bad. And so, but they kept getting a little better. And they had so many people in the stands cheering for them that my team who was playing them, they're like, what are these people doing? We're up, you know, 20-0. I'm like, so like, it wasn't just like, we're the drug team, right? So, like, I knew the story of, you know, what, like, they were here for more than just playing softball. And so playing my team, they got a couple hits, guy scored, he came across home plate with his arms out, like he just won the World Series. And one of our players was like, I can't believe this guy, like, doing all this. I'm like, you have no, just shut up. And it was their first run of the season. And so they kept coming back. The next season, it was a men's team and a co-ed team. And it, you know, it wasn't about the record. It was about arrival and competing and connecting. And so I think in that, it could be somebody who just comes, to go walk on their own, you know, a passion they already have, or it was pretty obvious most of these people had never played softball. But it was like they had a blast. They played for a couple seasons. And then I think, the ones who got better started getting on other teams and, making friends. So to see, kind of all of those different aspects.
Very wonderful. All right, so continuing this vein of thought, whether it is other programs that you wanted to mention, Erin, or any programs that everyone else has leveraged, what other community resources could we recommend for anyone who just wants to be able to connect and have a space where they can get away from the distractions or the things that might be working against their goals? What are some other resources or programs that people might want to just point out that we do have here?
So one of the things I tell people, and it's because it's true, is that you can tell somebody new in recovery that they're gonna have fun in recovery, that they're gonna have a blast, that they're gonna celebrate and enjoy life. But until they experience it, they do not believe you. They think it's gloom, despair, and agony, and that they're never gonna have fun again. Because all of their fun has been wrapped up in substances. Okay, so it's real joy to see people start to laugh again and to really enjoy life. And I mean, people around here laugh all the time, not only at each other, but I mean, with each other. And so, and part of that is finding those things, those joys in outdoor experiences and getting together and doing things, normal things that a recovering addict or alcoholic may not have ever experienced before. So there's all kinds of different, especially through the summer, there's campouts and there's recovery on the ridge and there's Serenity in the Smokies and there's rafting trips. And, so folks get together and have some fun. And they do it as a group of recovering folks, tubing down the little river. I think y'all went not too long ago, right?
Yeah.
To celebrate someone's 10th sobriety date. It's 20 women, I think. And boy, those pictures look like fun. So we do things like that to celebrate. And I'm sure there's lots of other things.
I'll just add on to that. I think, to some it's, and I know the least about recovery in here, so, but I think from things I've seen and, I think some may already have a passion, like the guy who ran, it was taking him back to when he was a long distance runner. And that's, something that he already had, where I think the softball group is building something new and learning together and, the social aspect. And I think, specifically parks and greenways and trails can help in that. Like we have a countless number of partners who might, do a fitness class or might, like we make lists of partners and it gets too long and then you forget half and you're just like, why do we even start? But whether it's a person going doing their own thing or with a group that, there's groups we don't even know who use parks that, meet out and do something. And so I think, that's always an option of, whether it's in a building or especially outside that, it could be some already have a passion or some it's a group working together for a common goal. And I think parks and public facilities can play a role in that.
And I think it's interesting too, like so many of our guys and gals are rebuilding their lives. So they're rebuilding their social network. They maybe don't have contact with their families. So, we always think of social media as being a wonderful thing and a negative thing. But as someone who's not native to Knoxville myself, when I first moved here, I took a lot of time to explore and see if I could find groups that were interested in and things like that. And I think this is maybe not a community resource, but it's just an idea for anybody that wants to maintain their sobriety, but also be active in their community. There's always volunteering opportunities. There's always ways to give back, but there's also a lot of good ways to have fun too. And so there are all kinds of groups that are centered around sobriety or some that are not, that are just groups of people who are having fun. And so I think getting out in the community and getting involved is a great thing. And there's lots of different ways to do that.
I mentioned too, we have sober tailgates through the football season here. Oh yeah, oh my goodness, they have fun. Yeah. You know, it's hard to go to a ball game sober if you've never been to a ball game sober. And so we do it together. We learn together. Yeah.
Beautiful. Okay, so we clearly have quite a lot that can be accessed here. But in terms of applying it and some practical takeaways, for those of you who especially might have some insights for this, what strategies could you recommend to help individuals who are in recovery and wanting that to stay long-term? What strategies would you give them so that they stay connected to these healthy environments, these positive programs, and all these other activities in the community? That's quite a face you're making.
Well, you know, you need to go to meetings, to go to 12-step meetings, go to Celebrate Recovery until you want to. Nobody wants to go to meetings in the beginning. It's a chore. You know, you have to talk about your feelings and stuff. It's pretty gross right off the bat. And so, but when you get to a place in life where it's like, oh, I want to go. And that's the idea, is you go until you want to go. So that's a strategy, is go.
Okay.
Sorry.
Come on in.
All right. So alongside the health and community resources that we have, we also wanted to take some time to talk about the personal and the professional resources that are available. So I'll start off with, and I know, Susan, this is a lot of what you do, but everyone is welcome to mention or to contribute some information here. How can developing interpersonal skills and time management and all these other kind of dry sounding skills support something as complicated as a stable recovery lifestyle? Any thoughts?
Can you say the question again?
Yes. So how do things like interpersonal skills and time management skills support a stable recovery lifestyle?
So I'll go. I don't mind at all. It's a careful way that I approach this with individuals, because sometimes, you know, when we talk about a life skills class, and you're talking about to a person who's lived a lifetime, that can be, you don't want to appear to be insulting an individual or, trying to detract from their life experience. But I think we try to provide just a lot of opportunities and a lot of fun, in some of the classes, to support, new skill building and just reinforcing, some already existing skills. We do an employment and life skills class Tiffany runs, and she has a great time. There's always a little incentive with a 30-day bus pass to kind of get people to come, but people genuinely have like a lot of fun. It becomes a social connection as well as some skill building. And I think it's just, when you start to build a trusting relationship with folks that you're serving, they become a little more open to maybe suggestions on some new interviewing skills or anything that's going to help if they feel like you're trying to provide services that's going to help them stay on their recovery path and help them move forward. I just think I'm a whole like relationship, like I think relationships are the most important part of this entire process. So
I feel like I can add to that. Like, I think it's easy to think when you're new to recovery that you're at square one. You're starting over, you know, maybe you've lost everything, or maybe you don't have what you used to have, and things are just different than they used to be. But I think you have to think of it a different way, and that you have skills. You know, you're not useless. Please don't think that. Please don't ever think that. Nobody in this room. Don't ever think about yourself. Don't think that you're useless. Don't think that you have no skills. Don't think that you can't do anything right. Those are just negative thought patterns that we don't need in our lives. You have skills. We just need to ration them in a different way. You have all of these abilities, and we meet people all across the spectrum who are very charismatic, who are very charming. We meet people who are wonderfully kind and who have very big hearts, and they've just been down different paths. And so I feel like I've completely lost track of your question.
I know.
I feel like, we all have our skills and we all have things that we're bringing to the table. We just need to build on top of those, is what I'm trying to say, I think.
Yeah.
And
So-
your response was totally fine. It's actually
Okay.
a perfect setup for the next question. So thank you. That was not. Yes,
I was gonna
absolutely.
say, a lot of times we think of, kids learn life lessons through sports
Mm.
and activities, and potentially in this case, I was thinking, pickleball is really popular. That even in this room, you could have a portable net or even use these chairs. But a lot of times, people learning things at the same time, that is, the rules are different than most other sports. And, you have the, conflict management, you have your keeping score, you're keeping the, maintaining the rules, rotating if there's more than 4 people here. And so kind of building those, even though you don't really think you are,
Mm.
and also getting that physical activity. And, just with pickleball, when we kind of really got it going 10 years ago or so, there'd be people like, I didn't realize I was really moving that much, and then I stopped and my shirt's soaked. And so I think something like that everybody can start out to be really bad. But you're still learning at the same time that everybody's picking each other up at the same time, and building some of these life lessons that we mostly think of with kids growing into adults. But I think learning something new with others.
Mhm.
I think that's the idea behind the art therapy and the music therapy classes that are offered here. It's, you don't have to be a fantastic artist to make good art and to get something out of your art, and it's very therapeutic. And the same thing with music. So.
And I think that's another, and I'm sorry, I know you had another question,
No,
but
you're good.
I think that's a wonderful, tip in the favor of a holistic approach to recovery, right? Because we like to think, well, this is what we need to address and this is how we need to address it, but you've got to think about the entire body, you've got to think about the entire mind, and you've got to think that people are different and they respond differently to different stimuli. So maybe for one person, it's art therapy. Maybe for another one, it's untangling relationships and, really getting in there and talking about their feelings. But that just doesn't work for everybody. Maybe a cooking class works for someone. Maybe it doesn't for somebody else. So I think that holistic approach is how we reach the most people.
Meeting our clients where they're at.
Absolutely.
Yeah.
I just need to say, Erin, we have a rec center in this building.
Oh, cool.
So we can play pickleball here, but we might as well just go to the rec center.
Yeah.
Yeah,
You should check it out.
yeah, we should check it out. It's next to the coffee shop. Yeah. We'll give you a tour. We'll make you a member. We'll make you a member.
So in talking about these other skills that we can learn and pick up through activities, let's also discuss maybe something related to like professional development. So Allison, you had mentioned sometimes there's this idea of like, oh no, I'm in recovery, I am starting at square one, I have nothing to offer. There's a complete blank slate in a negative way. So what role does career training, education, job opportunities, trade school certificates, all of these things, what role does a long-term recovery success, especially for someone who maybe didn't even think that they could shoot for those kinds of goals?
Fair. Well, I know for our individuals, everybody that we work with has a substance use disorder history, and everybody that we work with is just as involved in some way. So, and I think there's a lot of people in our community who are going down that same path. That's a parallel. And we can argue about, whether that's right or wrong all day long. And I will be the biggest voice for if people are in recovery, they don't need a jail cell, they need support. So, but we can have that conversation, and my boss wouldn't like me saying that, but anyway, or maybe Department of Correction wouldn't like me saying it. Yeah, it's recorded, fantastic. So now I can't even say that Susan said it. But, so, oh gosh, I know I've like completely lost my thought, but anyway, I feel like for individuals who are in the community and who are doing their best, I need the question again.
Totally fine. So career training,
Professional,
professional
yes.
development, what role does it play for long-term recovery?
Okay, great. I think so a lot, like I said, there's a parallel between people who have a substance use disorder and also are justice involved. And so it's what can I find that works in my background? What can I find that, someone will accept me? And people think that that's such a mar already against them, that, well, nobody's gonna work with my background. They're not gonna let me in school. They're not gonna let me do this. And they're so pleasantly surprised when somebody will work with you, when somebody does give you a chance, and and whenever you are able to get into a program and learn a trade or go back to school for the first time, and you're seeing your world through a new lens, and I think that's a beautiful, beautiful thing. But support through we try to support with our job readiness course. And so we find a lot of people who maybe have never had that kind of structure before. They've never really had a job, and if they did, it didn't last very long, or maybe there's something that's keeping them from being employable, or something that in their past was hindering their, employment. Maybe their mental health was a factor, and again, we can talk all day about, looking holistically at the individual and meeting them where they are. But yeah, I think we just have to do our best to support those individuals and encourage them that they can do hard things, that they can get involved, that they can go after their dreams. And just because they're, they've gone down this different route, that doesn't mean that there's anything wrong with them, or that they can't, they can't do amazing things with their lives, because they absolutely can.
So one of the premises of the 12 steps is that you give back, is that you help others, is that you transform your own pain into healing for other people. So that's why a lot of folks get into the addiction profession. They get clean, get sober, and then they want to give back, but they don't really know what they're doing. It's one thing to have the lived experience, which is incredibly helpful, but it's another thing then to educate folks on what are best practices for the addiction field. And so one of our visions here is to elevate the addiction professional community and the profession in this community. And so we offer lots of classes we offer a house manager academy. We offer classes for folks who are CPRS. We offer folks who are trying to be licensed alcohol and drug addictions counselors. We recently trained all the trained frontline staff for the treatment centers in the community, trying to help them to become, those professionals that they want to be. And so I think it's really important that folks in recovery who want to be addiction professionals get the opportunity to have that education. So then they can really, excel, and it really reframes that whole recovery experience for folks.
Mm-hmm. And I want to add too, there are so many great resources out there to help people build resumes, to help them put the experience that they do have on paper. Because like we said before, they're not starting at square one. They do have a history, and some of that history can be worded and organized in a way that can propel them forward.
You can have a skill-based resume and move forward.
Yeah.
I think there's a lot of stigma, when individuals are first in recovery, maybe in recovery housing, and they've got to make their rent, and they're finding that their first job opportunities are some jobs that they just didn't see themselves having to take. And I know we try to encourage the long view, that sometimes, this is the job for right now, so that you can focus on your recovery and you can focus on what you need to do for your health and wellness. And then let's touch again down the line and see, okay, so where can we move next? So again, it's those long-term relationships that I think it's okay. I remember I worked a job, I made coffee, and I ended up loving that job, but we can revisit this idea and continue to build on existing skills, and move forward from there. And that it isn't just like, a one job and okay, now you're done. Cause we don't do that. We grow in our field. We want to branch out. So having like a support team to hear your vision and to see what comes next.
Right, thank you. So all that being said, we do have time now set aside for the audience to ask questions. We also have some questions that came in before we started. So that being said, audience, any questions that you would like to ask the panel? All right, I'm seeing some head nods or head shakes. Thank you very much. If you do come up with any in the meantime, you're more than welcome to just go ahead and raise your hand and ask it. In terms of questions from before the session started, because during registration, we invited people to go ahead and submit questions. The first one is about Interfaith. Beth, if you wouldn't mind, could you give a rundown on the services that you provide and whether people who only work in Knox County but do not live in Knox County can access it?
Sure. So we serve right now about 20 counties. So we have no geographical boundaries. It's just, and even if you are not close to our actual facility, we can help our patients with transportation so they can get to their appointments. But we're primary care, general dentistry. If you come into our services and we discover that you need to see a pulmonologist or cardiologist, or we have a network of physicians in the area or specialists that can see our patients. So we can really kind of provide any type of healthcare that someone needs. What was the rest of the question?
So your services, and then I think you already addressed whether
Okay,
or not
yes,
you
yes.
get access if you don't live in this
Yeah,
county.
we also do prescription assistance for our patients. So we have somebody that helps walk them through the prescription assistance programs that the drug companies offer. And we can get them any medication that they need, a 3-month supply for $15. So just making it, we want to remove any barriers that would cause somebody to not be able to become healthy.
Great, thank you. Let's see. I might be wrong, but Erin, I think this next question's for you. As part of my recovery, I got a dog. My dog is my world. However, some places apparently I can't walk my dog there. How do I find what routes, parks, and other stuff will allow dogs there?
Yeah, so at really any park, dogs are welcome. There's a couple areas where they wouldn't be, but typically there are leash laws. So if you just went on a walk at, let's say, Castle Park near here, you could walk in on the greenway. You just have to have your dog on a leash. And then we have about 6 dog parks with the county. So there's not just city parks, there's also the county, Farragut, plus some other places that act as public parks. So there are some that are specific off-leash dog parks. And that's where it's, fenced in area, to where, you can go let your dog off leash and hopefully play with other dogs and not fight. But yeah, so out, like the ball fields at Castle Park, we have a rule that there are only service animals because there's kids running around, and a lot of times people like to let their dogs loose on a ball field, off leash, and let them run and play and do other things that they don't clean up. And so, but I mean, I'd say it's almost 100% of the areas where dogs are welcome in a park setting.
Wonderful. All right, as a dog lover, I support that decision. Okay, this next one is a longer one, and anyone feel free to answer or chip in with it. I have a chronic medical condition and am also in recovery. I've had bad experiences in the past where I've told this to my doctor or dentist, and it felt like they treated me worse after that. How do I find a doctor, a dentist, or whatever who won't make me feel bad every time I come in?
Oh, we're the answer for that, for sure. We have all walks of life come through our doors. We actually have partnerships with lots of organizations in town. The Community Coalition Against Human Trafficking, we hold appointments for them on Thursday so they can send their clients if they need to be evaluated. We have a relationship with Men of Valor. We have relationships with Centro. So we see all walks of life. And I can guarantee you that you will be loved on. And everybody has been down a different path in life, and everybody deserves to be loved on, and they deserve to be healthy, and they deserve to be around people that really, really care about them.
All right, and then the last question that we have is, for people who are returning to the workforce, especially for someone who might be on the older side, what resources or strategies would be available so that they can stay in recovery? Might be a tougher one.
Well, I don't see those as exclusionary, like being older. I mean, there's tons of jobs you can have that are recovery friendly. The only ones I wouldn't do is work in a bar or sell beer at the ball fields, you know. There's.
CAC has an,
I
didn't mean to cut you off.
No, go ahead, please.
CAC has an employment program open to anyone in the community. They would get assigned a caseworker who would work with them one-on-one to help match them to a position. They help write the resume. And then there's also additional supports once the person's employed. Let's say they need some appropriate work clothes or a uniform or a bus pass. They can provide that. And so every other Monday, there's an orientation session at CAC at the employment program. So that might be a good support.
All right.
Thank you, Susan. That was a much better answer.
All right. In the meantime, did anyone in the audience have any questions to ask before we close?
I do. I wanted to ask Beth about the qualifications to be a participant at Interfaith. What, as a recovery coach, what would we need to gather together to help them make that appointment?
So our patients are working individuals that do not have insurance. So if anyone in the home is working or if there's a source of income, then we don't take patients that make a lot of money, because we want to reserve our resources for people that don't make a lot of money. So I don't want to necessarily say there's an income cap, but yeah, so they just apply to become a patient. Like I said, if they work for somebody, we do ask for proof of employment, but if they work for somebody and they don't get a paycheck, then we just need maybe a letter from their employer. We have people that, you know, clean houses or do handyman work or this or that, the other. So we just want them to be working. It's really important for us because they pay a very nominal fee for their care, but that's important for us to help them grow. I hope that answers.
Okay, it does. And so would that include like the day labor places? Like if they work day labor, they could have something from them?
Yeah, yes, and what we'll do is just we ask for identification, but you know, nothing more than that. And pay stubs or a letter saying that they work for me and they make this much money.
Okay. All right. Well, thank you again, everyone, for your time today. Just to recap, in our session, we discussed about how recovery is supported through all these working synergistic elements: clinical care, therapeutic services, wellness opportunities, personal and professional development. And then together, these layers create a foundation for not just temporary, but lasting recovery. So everyone, please join me in thanking our panelists for their time today. And then thank you everyone who is watching this now, and then also our future, what I'm sure will be countless virtual audience. Thank you for your time and for joining us in this conversation. Our next session is next week, Thursday, October 9th. It is now October, essentially, whether you like it or not. I'm very, very sorry to deliver that news. But that session is going to be, we actually have a flyer for it. I think it's going to be at 12. And we have many flyers from all of our partners, all of our panelists here today. And so if you would like to promote it, if you want to register, if you know someone who needs to register for that, don't worry, the end is not here yet. So you are able to go ahead and register. That being said, we're going to go ahead and close the Zoom meeting and we'll end the session here. Thank you, everyone.